And so what I've learned in the research is has said if you were black back in the day, they had this coefficient implying that your kidneys were functioning, I guess, better than they actually were. So that means black patients had to be sicker than non-black patients to actually qualify for additional testing. Is
Correct.
that
Correct. It was in 2021 that they stopped using the coefficient. So, for instance, if your EGFR or your kidney functions were low, they were saying it was low because it was based on your race,
that's crazy?
which means a lot of times it was accepted in black people and black and brown people. It's okay to have those lower coefficients. But they found out it was just a social construct and they took it
It took
away.
them 40 to 50 years, people
Yes.
dying, people getting these kidneys, these diseases. It took them 40 to 50 years to realize that was not the thing that they should be doing.
It's what we talk about all the time. The disparities
Oh, God.
in medicine against black and brown people. We're
Wow.
not in the studies. We're not in anything. We're used
So
bias.
when I was married, so my mother-in-law had stage, well, so I got a call from my niece at the time, and she was like, "Look, grandma, I just learned that grandma has had stage like 1 or stage 2 kidney failure, and nobody has taken her to the doctor for a year." I was like, "What?" And so they were keeping it a secret, and I was like, "No wonder why she could barely walk." Like they're like all the stuff. They didn't take her to the doctor. And so what I did is I had someone give me like access to her medical records, and then I sent it to their cousin, and I said, "Yo, is what's going on?" And he was telling me all the everything that it said. And so then I had to kind of force it because she was suffering from dementia. She didn't really know what was going on, but nobody was really taking care of her. But I didn't even know that you could have these stages. So by the time I think she didn't go to the doctor for a year, and by the time she did go, I think she was on stage 3, so she had to be on dialysis. And by that time, it just went downhill from there. But she'd suffered from diabetes for a long time. She was taking insulin. She was getting, she was taking that shot every day. And so a lot of people, especially of that age, and I'm not sure about now, they just reconcile with, okay, well, this is what I have. This is what everybody in my family has. I have to take the shot, or I have to take this pill, and this is just what life is.
So let's first talk about kidney disease. So, kidney disease, number one, you can't live without your kidneys. Number two, it's the filter of the body. It filters everything, the toxins, everything in your body is filtered through the kidneys. Number three, you should not be filtering protein. If you have a lot of protein in your urine, then that tells us about the status of your kidney. So number one, there's stage one, which is mild. Stage two, which is kind of mild medium. Stage three is moderate. Stage four is severe. Stage five is kidney failure.
Mm.
Okay. And so diabetes, because it is high in black and brown people, is a direct link to kidney disease and kidney failure. It stresses the kidney. Stress on the kidney causes strokes and heart attack also. So
Mm.
it's the whole system of being um, an attack on our system and being diagnosed not in time because of this coefficient that they put on all the lab work. So someone in the comments asked, did black doctors know this?